So traditionally, when an amputation was necessary, it was performed, and then the reconstruction was really limited to using a prosthetic and socket technology. Patients complain about having a socket. It's too tight, it's too loose, it's sweaty. I'd make a quick turn and my body goes one way and my leg goes the other way. The essential problem has been connecting the prosthetic to the patient, and that connection has been compromised. People lose energy and they lose stability in the connection point between the prosthetic and the patient. And that's where osseointegration comes in, and that's where it has been transformative. So what osseointegration does is it gets rid of the socket and it allows us direct skeletal connection with the prosthetic limb, and patients' mobility soars. I mean, we have been doing this now for 8+ years. We've got over 200 cases, 200 patients under our belt at this point, and we are seeing in all of our longitudinal studies that patients' mobility, patient-reported outcomes are tremendously improved with osseointegration. People are happier, they have better endurance, they have less pain, and they have better functionality.